Hello everyone. Today we are going to discuss is about syncope. What is the other name of syncope? It is also known as fainting. So here you will see transient loss of consciousness that occur due to reduction in the blood flow to the brain, that is temporarily. So what could be the causes of syncope? It could be due to the stress, lack of sleep, excessive heat, excess heat, sight of blood, etc. Now the sight of blood or needle. Now what are the sign of syncope? You would see pallor of skin, the pupils they are dilated, there is cold, perspiration, nausea, and small pulse pressure. Now the management of the syncope, you have to immediately lower the lower patient head below the level of heart. So that helps to bring oxygenated blood to the brain. So you can achieve this by reclining the dental chair so that the patient head it is lower than their legs. Apart from that, what you can do is leg elevation. You can elevate the legs, that helps the blood flow to return to the heart. Apart from that, aromatic spirit of ammonia, that could be given, so that stimulates them and bring them back consciousness. Second condition we are going to discuss is the shock. Shock, it's a serious condition that is characterized by insufficient blood flow to the vital organs that lead to failure, that lead to systemic failure. It is result of severe imbalance between the volume of blood and capacity of the vascular system. Now, shock can be primary shock. The primary shock is caused by sudden emotion or pain leading to blood vessel dilation. It can be triggered by factors like fear, severe pain, or sight of blood. The primary shock so refers to the initial response of the body to sudden insult like trauma, pain, fear. This type of shock is primary neurogenic in origin. That means that it originates from sudden disruption in the autonomous nervous system control over the blood vessels. Now, pathophysiology. So, this type of shock is associated with sudden emotional response, like you will see pain, extreme pain, fear, or even the sight of blood. So, what these stimuli do, they will trigger the autonomic nervous system specifically the parasympathetic nervous system, that leads to vasovagal action. So this reaction causes vasodilation, that is, there is widening of the blood vessels that results in bradycardia. So both the vasodilation and bradycardia, they together leads to drop in the blood pressure. So because of this drop in blood pressure, the brain and other vital organs receive less blood flow, that causes symptoms like dizziness, faintness, and even brief loss of consciousness. This is why it often seen in scenario like patients suddenly fainting during minor surgical procedure or after receiving distressing news. So how does a patient with primary shock present? First of all, there would be the patient would appear pale due to the vasodilation and pooling of blood away from the skin. Second, sweating could be seen. Often cold sweat is present due to autonomic nervous system activation. Third, dizziness or fainting could be seen. A lack of adequate blood flow to the brain can cause dizziness, lightheadedness, or syncope. Apart from that, weak pulse may be seen. The weak pulse, the heart rate may be slow and weak. Hypotension, low blood pressure, it is the hallmark of the condition. Now, the management of this primary shock, the first step is to lay the patient down in supine position, elevate their legs, and that is known as Trendelenburg position. So this helps to increase the venous return to heart and improves the blood pressure. Second is ensure a clear airway and adequate breathing. Check the airway to ensure it's clear and provide oxygen if necessary. Calmly reassure the patient. The vasovagal reaction often occurs due to emotional stress, then reducing anxiety can be very helpful. We have to monitor the vital signs such as heart rate, blood pressure, and respiratory rate. You have to avoid any triggers that may cause the vasovagal response like sudden pain, emotional distress, or even specific smell. So this was primary shock. Other is secondary shock. The secondary shock, remember, it occurs. It is the true form of shock that is hormonal in nature, that appears hours after injury or stress due to the disparity between blood volume and the vascular capacity. The third is the ischemic shock. The other name is hypovolemic shock, that is characterized by reduction in blood volume due to hemorrhage, burns, or dehydration. Hypovolemic shock is also known as polygamic shock, that occurs due to loss of the blood or fluid leading to decrease in the circulatory blood volume. So this reduction results in inadequate tissue perfusion and oxygenation that can lead to organ failure. Now, what are the causes of hypovolemic shock? The primary cause is significant reduction in the blood flow. So that can occur due to various several features. First is the hemorrhage, the most common cause, and that can happen due to trauma such as road traffic accident or severe injuries is the hemorrhage. Surgical complication may be seen GIT bleeding or rupture aneurysm. Second is burn. Severe burn can lead to fluid loss from the damaged skin and increase vascular permeability, causing fluid to leak into the interstitial space that lead to reduction in the intravascular volume. The third is the dehydration. Condition like severe diarrhea, vomiting, excessive sweating can lead to fluid depletion. So conditions like the diabetes ketoacidosis can result in significant fluid loss. So each of these conditions lead to decrease in the blood volume that reduces venous return to the heart, and that causes decreased cardiac output and lead to poor perfusion of tissues. So here in hypovolemic shock the body experience loss of intravascular fluid, so that lead to decrease in the preload, the amount of blood that is returning to heart. As a result, cardiac output decreases and there is reduced oxygen supply delivery to the tissues. Now, in order to compensate, the body activates sympathetic nervous system that leads to release of catecholamines like adrenaline, noradrenaline that causes vasoconstrictor, that is they construct the narrowed blood vessels to maintain blood pressure and redirect the blood flow to the vital organs like the brain. The renin-angiotensin system is also activated that causes kidney to retain water and sodium to increase the blood volume. However, if the fluid loss is not quickly corrected, these compensatory mechanisms will fail, leading to organ dysfunction, multi-organ failure, and even the death can occur. Now let's talk about the present, how a patient with hypovolemic shock might present. First of all, you will see the heart rate would increase. So you will see tachycardia. Tachycardia, the heart rate increases as compensatory mechanism to maintain the cardiac output. Second is hypotension, low blood pressure. It's the hallmark of the hypovolemic shock. So there is low blood pressure. Apart from that, pale, cool, clammy skin. Due to peripheral vasoconstriction and redirection of blood flow to vital organs. Other you will see is decrease urine output, the kidney responds to reduce perfusion by retaining water to preserve blood volume that results in oliguria. As the brain gets less oxygen, the patient may become confused, agitated, or even unconscious. So these signs are essential to recognize early because the quicker hypovolemic shock is identified, the better would be the chances of survival. Now, stage of hypovolemic shock, we classify them into four stages based on the percentage of the blood volume. Stage 1, Stage 1 is the mild shock, and up to 15% of the blood loss could be seen. So the body compensates well and the patient may have mild symptoms like increased heart rate. Stage 2, that is moderate, and here you will see 15 to 30% of the blood loss. Tachycardia, decreased urine output, and anxiety may be present. The stage 3 is severe shock, and here 30 to 40% of the blood loss is seen. Significant hypotension, tachycardia, confusion, and reduced urine output is seen. The stage 4 is light threatening, where more than 40% blood loss is seen. Here you will see pronounced hypotension, bradycardia, unconsciousness, and multi organ failure can occur. Now, management of the hypovolemic shock. First is fluid resuscitation is the cornerstone. They start with the isotonic crystalloid, that is normal saline or ringer lactate. Rapid infusion of around 1 to 2 liter is given. If there is ongoing hemorrhage, blood products like packed red blood cells, fresh frozen plasma, and platelets, they are essential to replace the lost blood components and maintain oxygen carrying capacity. So, monitoring vital signs, urine output, central venous pressure, it is essential to assess the patient response to treatment. Oxygen therapy can be given. Vasopressor may be considered in the refractory cases where the fluid resuscitation alone does not restore the blood pressure, but only after the adequate fluid replacement to avoid worsening tissue perfusion. The other is the cardiogenic shock that results from heart's inability to pump effectively, and it is seen in conditions like myocardial infarctions or severe arrhythmias. So cardiogenic shock is advanced form of heart failure that occurs when suddenly the heart cannot pump enough blood to meet the body needs. So it is condition that demand immediate attention, often occurring in ill patient, especially in events like MI. So here the issue lies within the heart pumping action itself. So cardiogenic shock is the most common cause by condition that affect the heart muscles ability to contract. The cause is MI. So the most common cause of cardiogenic shock is MI when a significant portion of heart muscle is damaged, especially the left ventricle. The heart loses its ability to pump blood effectively. Severe arrhythmias like ventricular tachycardia, fibrillation, and complete heart failure can result in decreased cardiac output and lead to shock. Cardiomyopathies, diseases that affect the heart muscle such as dilated restrictive cardiomyopathy can lead to weakened heart that struggle to maintain adequate circulation. So condition like papillary muscle rupture, ventricular septal defect, regurgitation, mitral regurgitation following MI can precipitate the cardiogenic shock. So due to the heart's inability to pump effectively, there is reduction in the cardiac output. That means the amount of blood being injected from the heart into circulation Mechanical conditions like papillary muscle rupture, ventricular septal defect, or mitral regurgitation following MI can precipitate this cardiogenic shock. Now, coming to the pathophysiology of the so first of all, you would see the compensatory mechanism. The body attempts to compensate by activating the sympathetic nervous system that leads to increase in heart rate and peripheral vasoconstrictor to maintain blood pressure and perfusion to vital organs. The RAS system is also activated, leading to fluid retention and increase preload. So there is the body compensatory mechanism increase the workload on already failing heart. There is increase afterload, that is the resistance again which the heart must pump make it more difficult for weakened heart to eject blood. So that leads to decreased tissue perfusion. So despite these compensation, the tissue and organ continue to receive inadequate blood flow and oxygen, leading to ischemia, lactic acidosis, and eventually organ failure. Now, clinical presentation, the hallmark of shock where systolic blood pressure is usually below 90 mm of mercury. So there is hypotension, there is tachycardia. The body attempts to compensate for low cardiac output by increasing the heart rate. Due to peripheral vasoconstrictor, the skin becomes cold, clammy skin. Due to increased central venous pressure from the blood backing up into the venous system, you will see jugular venous distension. Apart from that, pulmonary edema. Patient presents with a dyspnea, crackles on the lungs examination, cough with a pink prathysputum indicating fluid accumulation in the lungs due to poor left ventricular function. So there is reduced perfusion can lead to confusion, agitation, or even loss of consciousness. There is decrease in urine output due to reduced renal perfusion. So diagnosis can be done with the help of, we can do is ECG, echocardiogram, or invasive monitoring with pulmonary artery catheter can provide detailed information about the cardiac output, preload, afterload, and systemic vascular resistance. Now coming to the management of the cardiogenic shock. The management of cardiogenic shock you can do is revascularization for patient with MI, early reperfusion with percutaneous coronary intervention or coronary artery bypass grafting is important to restore the blood flow to heart muscle and limit the damage. Apart from that, drug like dobutamine can help to increase the cardiac contractility and improves the cardiac output. Apart from that, diuretics like furosemide, it helps us to, it can reduce the preload and relieve the symptom of pulmonary edema. Mechanical circular sport you can do is intra-aortic balloon pump temporarily support the heart by reducing afterload and improving coronary artery perfusion. Ventricular assist device can be used. Equatorial membrane oxygenation can be considered in severe cases to provide both cardiac and respiratory function. Other type of shock is the septic shock. So it is caused by severe infection leading to toxin induced vasodilation and poor circulation. So what are the causes? It is caused by severe infection due to the bacteria, viruses or fungi, or it may be parasitic. The most common bacterial infection are the gram negative bacteria like E. coli, Klebsiella pneumoniae, Pseudomonas aeruginosa can be the cause, or gram-positive bacteria like S. aureus or Streptococcus pneumonia. Pneumonia infection of lungs are the common causes of septic shock, especially in hospitalized or immunocompromised patients. So remember, in case of immunocompromised patient, the most common cause is the infection of the lungs. Apart from that, severe UTI infections can be seen when they spread to kidney, can lead to septic shock. Abdominal infection could be seen, skin and soft tissue infection like cellulitis, infected wound can lead to septic shock. Other infections like meningitis, endocarditis can trigger septic shock, especially in the patient who are elderly or who are with weakened immune system response. Now the pathology of the septic shock. The first of all, there is systemic inflammatory response. The body immune system releases excess of the inflammatory mediators like the cytokine, tumor necrosis factor, alpha interleukin 1. So these are the factors that are released in response to pathogens or their toxins. So this cause a systemic inflammatory response that can damage the tissue and organs. Apart from that, these inflammatory mediators causes widespread these inflammatory mediators cause widespread vasodilation leading to drop in the vascular resistance and blood pressure. Apart from that, there is increased capillary permeability. The inflammatory response also increases the capillary permeability that lead to fluid leakage from the blood vessels into the tissues. So that results in hypovolemia that contributes to low blood pressure. So as septic shock progress, the lack of perfusion and oxygen to vital organs can lead to multiple organ failure, including the kidneys, liver, lungs, and heart. The patient with septic shock typically presents with the following signs. First of all, there is hypotension. Despite adequate fluid resuscitation, the patient remains hypotensive, often with systolic blood pressure of less than 90 mm mercury or 65 mm of mercury. There is cold, the present with the warm shock characterized by flushed warm skin due to vasodilation. As the shock progresses, they may develop cold shock with cool, slimy skin due to poor perfusion. Rapid heart rate and rapid breathing are compensatory response to maintain the oxygen delivery to the tissues. There may be fever, altered mental status, elevated lactate level, increase in the lactate level due to the anaerobic metabolism that is the key marker of the tissue perfusion. Diagnosis of septic shock includes laboratory tests, complete blood count, blood cultures, lactate level, arterial blood gases, coagulation profile, and biomarkers can be used. Apart from that, chest X-ray, ultrasound, CT, MRI can be used to identify the source of infection. Fluid resuscitation can be given, typically crystalloids like normal saline, lactate, ringer, to restore the intravascular volume and improve the tissue perfusion. Broad spectrum antibiotics can be given to cover. They should be given as soon as possible after obtaining the blood culture to cover a wide range of potential pathogens. So you have to identify the source of infection, drain the abscess, remove infected devices, and surgical intervention in cases like perforated bowel or necrotizing fasciitis. Supportive care that involves oxygen therapy, organ support can be given. So these are all. Other type of shock is neurogenic, that occurs due to the nervous damage leading to excessive blood dilation. So that results from damage to the nervous system leading to loss of sympathetic tone and massive vasodilation. So cause could be spinal cord injury, spinal anesthesia, medication, toxins like general anesthesia or ganglionic blockers can cause neurogenic shock. So here you will see loss of sympathetic tone, due to disruption in the autonomic nervous system. Vasodilation may be seen, blood pooling and reduced venous return, bradycardia, hypotension, and hypoperfusion. So these are the features of the neurogenic shock. The skin is warm, dry, loss of reflexes below the level of injury. In case of spinal cord injury, there may be loss of reflexes and motor or sensory function below the level of the injury. So diagnosis you can do is the neurological examination, laboratory test can be done like CBC, electrolytes, arterial blood gases can help to know the extent of shock. CT scan, MRI of the spine of the brain may be done to know the location of the injury. The management includes the stabilization of the spine, fluid resuscitation, vasopressors like norepinephrine, dopamine can be given. Atropine can be given for bradycardia management, oxygen therapy that includes the supportive care can be given, corticosteroids can be given, etc. Other is anaphylactic shock, that is allergic reaction to substance that includes medicaments causing a rapid onset of shock. So other is miscellaneous type of shock due to conditions like hypoglycemia or adrenal insufficiency. So these are the all type of the shock.